Hello, everyone. Welcome in. Thank you so much for joining us today. We are going to get started in just a moment. Really glad to have you joining today for our Lunch and Learn. So thanks for being here. Um, Hold tight and we'll get started in a moment. All right, we have a few others joining us. Welcome in. Thank y'all for joining today. Really excited to have you here. We are going to go ahead and get started so we can get y'all out of here by 1 today. For those of you who don't know me already, my name is Jacqueline Cook. I'm an advisor at TrepWise. I'm joined here by my colleague Jordan, and we work for a strategy-based consulting firm here in New Orleans. We work really closely with the Louisiana Department of Health on the Whole Health Louisiana initiative, which is bringing this Lunch and Learn to you here today. So for any of y'all who have not been to one of our Lunch and Learns already in our series, or if you're not totally familiar with Whole Health Louisiana, just to give y'all a little bit of background, Whole Health Louisiana is our state's cross-sector initiative to address, mitigate, and prevent childhood trauma and adversity within our systems of care and support. Like I mentioned, we're supported by the Louisiana Department of Health. That's our public sector anchor. And then TrepWise is serving as the statewide implementation lead for the next 3 years of our statewide plan. We have a couple different priority areas that we focus on in our statewide plan: collaboration, awareness, workforce, and then prevention and healing. And this is really all in service of our vision, our collaborative that we have, who shares a vision to have a state where our children, our families, and our community members all across the state are healthy and thriving, regardless of who they are or where they live. So, in line with our vision and our priority areas, Whole Health brings these Lunch and Learn series to all of you, really trying to advance our plan by helping connect folks to learnings from industry professionals and subject matter experts to help raise that awareness of our work and the importance of understanding trauma-informed care, and deepen the conversation around trauma-informed practices. If y'all are interested in attending more webinars in the future, we do have more listed on our Eventbrite. You can go back to where you registered today. We will have more in the future. We have one every month. Just a couple housekeeping items, and then I promise I will stop talking and toss it over to our speaker for today. For those of you who are attending looking for education, continuing education credits, really important, you must stay for the entire session and you must complete our post-session survey. That's how we know that you attended today, and that's how we are able to issue your credits. For today, we are offering both nursing and social work credits. We do not have licensed professional counseling, LPC credits available for today. So just want to make that clear for everyone joining. And we'll put a reminder at the end as well. That's where we'll drop the link to our post-session survey. We'll also have a Q&A towards the end of the session in the last 10 to 15 minutes. If y'all have questions throughout the presentation, you don't have to wait till the end to share them. Send them through. We will keep track of them, and then we will kind of go through those at the end. So feel free to send those as they come up for you. The last thing I want to name is that this webinar is being recorded. It will be posted to the Bureau of Family Health's YouTube after the session, within a week. So you can, share that with anyone who may be interested in this topic, but who wasn't able to join today, or if you want to go back, you're welcome to as well. All right, without further ado, I am pleased to introduce today's speaker. Today with us, we have Tekoa Boatner. She is an experienced nonprofit executive. She is a consultant and a board-certified human services specialist. She has expertise in stabilizing organizations through culture-based program design, and is currently the executive director of Youth Oasis. For those who aren't familiar, that is a Baton Rouge-based nonprofit that supports youth and young adults who are recovering from the trauma of homelessness and family separation through housing, healthcare, and advocacy. Really fantastic organization. I highly recommend looking them up. And so today I will toss it over to Takoa. She's going to be talking about building trauma responsive youth systems. So thank you so much for being here and feel free to take it away.
Thank you, Jacqueline. I appreciate the opportunity. I am flying a little bit blind. I can't see anybody, not being rude, but I'm just going to get at it. As Jacqueline stated, I am the CEO of Youth Oasis, and we've been around since 2017. And I mention that solely because this is what kicked off my interest into trauma-informed care and training in it. So I am a member of the Whole Health Program Coalition, but I'm also a ACES certified trainer and with LDH through the program. And I've been with them for a while. And that happened because I, as the CEO, am responsible for getting the evidence-based practices and training staff. And what I recognized is that a lot of the things that I was training them to do with youth was a bit disconnected because it had never been done with them. And then that just leads into understanding how to incorporate adverse childhood experiences from an informed status, but moving from informed to healing centered. And understanding that the majority of the resources and the things that we're going to need to resolve and address trauma aren't coming within the institution where it presents. And what's really necessary is a community-wide effort because it is a communal thing. And so what I'm asking for you for the next 30 minutes is while you're listening to me talk about this, I want you to be thinking about behaviors communication. One of the things that we start with in at Youth Oasis with training is behavior is neutral. Behavior is communication. We get focused on behavior and we forget that that behavior is communication. And that's even more important to remember when you're thinking about youth, because in addition to lack of experience, they also have lack of knowledge in terms of words, right? Some of our kids now have much better language than we had growing up. And it sometimes throws the adults off a little bit because we haven't kept up with the expansiveness of communication around behavior and understanding that seeing these responses as the brain doing exactly what it's supposed to do. I also want you to think about treating community, how community is, how community is built, how communities maintain. That is the actual intervention. Also do another presentation talking about what do we need to help prevent youth getting into homelessness, and it is focused on the community. There are four specific things any community needs to have, right? And so we're not looking at how many people are, how many providers, how many institutions, how many organizations are available. What does the community where the child is experiencing life, how is it set up for healing and addressing experiences with trauma? And then I will be giving you some things that you can take with you. That is a big thing for me when I give presentations. I want you to have something that you can do when you leave. All right. So I'm going to ask you to put this in the chat. I won't be able to see it, but I would like to know what community support means to you and what how you express that. And Jacqueline, can you read to me what we're having in the chat? Are people able to chat?
Yeah, absolutely. Yeah,
Okay, I
folks
wasn't
should be
sure.
able to, they won't be able to see each other's chats, but we can see your chats. So if folks can go ahead and drop that. If you want to maybe restate the question to Koa
So
one.
the yes, what does community support means to you? Just one word.
Okay, we have folks saying it means showing up, connection, community support, which is everything, security, assistance, unity, listening, meeting needs together, compassion, belonging, meeting my needs, help, resources. Yeah, we got a lot of good ones. Thanks, everyone.
Good. Good.
Education.
Cool. Thank you all for participating in that. So, and just as an aside, you can also turn your chat waterfalls into something tangible, right? And so when you get that, or when you have that, what I would typically do is I would take the people who mention the same words. You're now in a committee and you're going to define what that looks like, right? So meaningful support is something that came up a lot, community connection. How do you then turn that into something tangible within your community? What does that look like? Right. And so heading right in. First step, behaviors communication. It is neutral. So what trauma acts of young people is going to show up as adaptation. So when you have a kid in school, you have a kid in, you run a residential program, you have a kid in that program, you're in a hospital setting, a kid is there, you're at your home, a kid is there. Past experiences lead to adaptation. Your brain decides how to respond to this to keep you safe. That is what you're seeing, that what behavior is, because all of the things that's occurring within that setting will inevitably at some point lead to an unmet need that bumps up against an unlearned skill, right? That is what a temper tantrum is. So when we learn about adverse childhood experiences, one of the first things that they talk about is your coping mechanism. That's what leads to that. Fight, flight, freeze, or fawn is the major four. That's the first four. There are a whole bunch more now. I do not commit those to memory, but these are the basics of where you can classify what behavior is falling into, and it's communicating something to you. So when a person is in fight mode, fight, they're acting aggressively, they're responding, that is defiance. That's protecting their self, their sense of self, their self, and their autonomy. That is very central to who they believe they are, and how they negotiate threats to that is by showing up with aggression or defiance, because that's a learned behavior also that was shown in their experience to be how to resolve this type of issue. And what does the brain do? The brain goes through some files and it goes, this is making me feel this way. Oh, I saw this before. This worked over here. I'm going to do that. Right. Same thing with the rest of them. Flight, avoidance, you have truancy, you have running, they're seeking safety the only way available, which is to leave. And leaving is not always a good thing, a bad thing. Again, behavior is communication. One of the key things I tell my two children is you can always leave. I do not care where you are. If you find yourself in an environment and you do not feel safe, you do not feel comfortable, you don't feel welcomed, leave and call me and I will participate in you leaving, right? And so understanding that that flight is always there as a mode of protection, when you're seeing that, the first thought isn't, oh, they're running away. It's, okay, they ran from something, right? That's a signal for us. Yes, there are legal things that we have to do, especially in a residential program, right? Or a school setting. A kid leaves, you got, that's a legal issue and you need to deal with that. And yet, what needs to happen after that, our runaway protocols are all very externally based, which is why they are not as effective. They are focused on containing the environment. They're focused on containing the child, missing the fact that the kid was running from you generally, right? But something in there, something in that environment said, if I stay here, I am not safe. I gotta go, right? Freeze. You're shutting down, they're disassociating, they're conserving energy because I don't know what to do. All right. So since I don't know what to do and doing something may be worse, let me just not do anything. This shows up as a kid that's being really, really quiet and not answering a question. All right. And unfortunately, that can be viewed as disrespectful sometimes. And so they're shutting down, they're disassociating. Some kids go in, right? And they're freezing and fawn, people pleasing, over compliance. They're trying to earn safety by appeasing. Another thing that I have staff and other organizations that I work with look out for. You have a kid that comes in and they're new, and the first thing they do is get to cleaning, and they are your best kid, right? That's a tell. Take a step back. Why do you feel that you need to appease me? Because I want you to have these behaviors, but they need to be internally motivated, not externally motivated, right? So these are all survival responses. How we speak matters, right? And so how we describe a kid matters, right? We work with kids that are exiting foster care. We work with kids that are exiting juvenile detention. And unfortunately, there are helpers in our field working with those youth, and they call them by the label, or they're a criminal, or they are who they are is who they are when they are here in this environment. And that name, that label that we give them defines how we treat them, right? And so when we're calling a kid defiant, we're recognizing that they're protecting their autonomy after autonomy was taken. That's what that defiance is about. That defiance is saying, I am here and you're discarding me, and I refuse until you recognize me. Manipulative. They're meeting a need that the direct route didn't work for, right? Something that happens a lot with kids that are being moved around in foster care and things like that. They quote unquote act out, and that causes the caseworker to have to come. That causes sometimes a removal request. Sometimes that causes the police officers to come, right? And again, what we realize when we take a step back and we decenter our knowledge, education, and we focus on connection, when they do that, what happens? Things move. Right. So the first time they asked, whatever it was they asked for, it wasn't met. But when they did this, when they started a fight, when they started screaming, people moved. It's meeting a need in an indirect route. Right. But when we call it manipulative, we feel like, oh, well, we can discard what's actually happening because they're trying to manipulate you. Okay, if they are, why? That means they feel they need to get something from you that you're not getting that you don't give when they give a direct ask, right? Runaway. They're seeking safety. Yeah, they ran away. That's the terminology that we use, but they're seeking safety, and usually from the placement itself. One thing, when kids used to run away, where are they? They're at home. I know where they are. Like, we all know where they are. Usually the kids that run away, they call us and tell us where they are. Not because they're not running away from us as a person. They're running away from the placement. They're running away from the situation. Attention seeking, this is a big one. We don't use that word. We use connection seeking because that is what they're looking for. This is a connection seeking. This is a person who learned that the only way that I'm seen is to be loud about it. The only way to get what I need is to be loud about it, is to make sure your attention is focused solely on me. It is connection seeking. I need you to connect with me. Another example, my son was here and he had a play date over the summer, and he started annoying him, and so they're fighting about it. And I said, first of all, son, this is a guest. You asked him over here, you need to chill out. I said, but remember, if he's doing that, there's something he wants. So how about you go back and ask the conversation and say, dude, I've asked you to stop. You keep doing it. What's up? Tell me what you need. That conversation worked. These are 8-year-olds, but no, I'm sorry, 9, by the way. So these are 9-year-olds. And that conversation worked. And of course, they're still 9-year-olds. These are still 9-year-old kids, because then I hear my son say, dude, why you didn't say that? I didn't know that. And I'm like, oh, okay. It worked. The point is, he understood the assignment, right? Connection seeking, not attention seeking. And of course, non-compliant. And when a kid is not compliant, essentially what it said is, you're doing something to me, not with me. I have no reason to participate. Right. And that is a big thing that you'll hear me say a lot about most youth institutions. They do things to kids, including school. They do things to kids, not with them, and then wonder why they're not engaged and fully participating, right? This is human-centered language. That's the term for it. And it is a trauma-informed practice. It's not just you being nice. I used to explain human-centered language and human-centered design as hospitality on steroids, but it's trauma-informed care, right? And so being in the system, what I learned a long time ago, because this is my second round in child welfare, but in all of the other systems that I've worked in as a professional helper, I've often faced the notion that we're harming more than we're helping. We're perpetuating the system that we're in based on how we decide to act in that system. And so if we are serious about addressing trauma, if we really want to get to healing centered, we do need to understand where we're perpetuating it, where we are re-traumatizing, right? And so we are building these systems and they're designed to protect, but we often replicate, right? And so systems with high surveillance, right? Monitoring like that communicates suspicion. It doesn't communicate care, right? And that's not to say that children don't need supervision. Clearly, children need supervision, but there is a difference between supervision and surveillance. Supervision is observation leading to the outcome of safety for all involved. Surveillance has a consequence attached to it. It's not just monitoring for your safety, it's monitoring for correct action in a controlled environment. That is surveillance. And some of our systems require it as a matter of uh, theory of change, right? Punishment, external punishments, consequences for survival behavior. If you do X, this happens. That's discharge, detention, suspension. Another thing I talk a lot about is when we have interventions with kids, the first level of that intervention typically involves separation. And that right there is where we've gone down the rail a little bit. And the reason being, my shorthand for empathy is being with while, meaning I will be with you while you go through this. I am not affected, or I am affected just by being with you, but I'm not attached to what happens. I have no stake in how you process this, but I do understand that you need somebody to be with you while you experience what's happening. When a person breaks a rule, when they do something against the expectations. And it is absolutely okay. And it should be required for any environment to have a set of norms and expectations. And when a kid doesn't meet those expectations, they already know that they're in danger of being excommunicated from the environment. That's not what they want, but they made a mistake, right? Logical consequences aren't consequences that lead to separation typically. There are some, but that is a choice. Punishment is a choice, and the consequences must be um, logical. They can't be external, and they can't be consequences that make the adults feel better about doing something, right? Removal, again, same deal. Separation from family, school, and community. Essentially, especially for young kids, when you say leave, you're saying I don't want you here. Your expression, everything about you, because they have limited knowledge, right? Is not welcome here. So when there's a separation, the separation is a request, but there's never an invitation to return. It's an expectation to return. That is incongruent. That sets up a negative association within a child's brain. And then, of course, conditional care, meaning for you to get X, you must do Y, right? You will only get these benefits if you act in these ways. Having an expectation again is never a problem, but it's when those expectations are not the expectations that the youth has come up with. These are your expectations. You're imposing these conditions on basic needs to receive basic needs. That's a harmful system, right? And so when any help that we provide, when it separates people from connection, you're re-traumatizing, you're deepening the wound. And we're supposed to be interrupting this cycle. That means we got to start with us, right? And so this is just over time what kids have been telling me, and kids everywhere, really, wherever I talk to them, see me as a person, not as a case, not as the next student. Don't, make me a amalgam of all of the students you've ever taught ever, right? That's dignity. They want predictability. Tell me what happens next and tell me when that changes. As adults, we tend to have the benefit of knowledge, experience, and all the information, and we have kids with us, and we make the decision that they don't need to have that level of detail. But for kids who are and have had experiences of trauma, that detail, that information, whether or not they know what to do with it, the fact that someone cared enough to inform them. Giving predictability. Predictability is consistency. Consistency leads to trust. Trust is what happens. Trust is what you'll need for them to do anything you want them to do. All right. Connection before correction. Predictability matters. Being believed. Believe me the first time. Every kid that comes with a complaint, that complaint is taken valid, even if we already know that they're lying, right? It's not about being right. It's not about constantly showing that they're wrong. It's showing how it's maintaining connection so that I can get you to see why this did not work for you, right? But it starts with believing them. Okay, come show me, right? Whatever the case may be. Believe me the first time. That again is building trust. And don't make me earn the basics. And the basics meaning outside. Right? I get to go outside. I get to go to the bathroom. I get to eat when I'm hungry. I get to take care of my bodily needs. I should not have to earn that. I should not have to ask for that. Unconditional care. Stabilization. So when we talk about community as the intervention, what does that look like, right? That's safety, that's predictability, that's connection, and that's dignity, right? Are they physically, emotionally, and culturally safe, right? They have to feel it. That you can't just say you're safe here if you're not then setting conditions where they can feel it emotionally and physically. Predictability, say what's going to happen and say when that changes. Consistency, routines, predictability helps you feel trust, right? Connection. How many connections do they have with a caring adult, right? It be maybe it's family, maybe it's peers within their culture, within their community. How well do you know the kids in your neighborhood, right? And dignity, having their own choice, voice, and power about what is happening to them because they're in these systems, and yeah, adults are making the decisions and they are still going through it. The longer they don't practice the muscle of choice, the harder it is to reach that golden critical thinking that we lament so much about adults not having that we work with. Well, that's because they spent a lot of time not having choice, voice, and power, right? That was taken from them or reduced or negated through their experiences, right? Critical thinking requires the practice of choice, voice, and power. And so these are all preventions, right? Community as the healing modality is a part of prevention and it is upstream, right? This is how we stop kids from falling in that river. Prevention, intervention, and crisis response. That's your system of last resort. Youth Oasis is a system of last resort, right? When the kids come to me, they've been in that system for years. It is the rare kid, and we do get some, but it is the rare kid where we're the first stop, right? And whenever they leave, my thing to them always is, I do not want to see you back here. Right. And I say that to them to give the expectation that, yes, you have a part, you have a role in this. I also say that understanding that they may not have a choice again. Right. And so every time we are intentional about the money that we can put in to prevent these more expensive interventions, the better, right? This is a crisis that we can prevent by changing where we put our focus. So here are four community-rooted supports that help to stabilize that. This is something that we've incorporated, and I encourage all other organizations to incorporate this as much as possible. Flexible, material, tangible assistance. When a person is resolving or navigating trauma, especially youth, there's been a breach. There's been a breach of trust. There's been a breach of community. There's been a breach somewhere. Before you're able to actually make any headway, you need to give something because you're asking for something. They have to fill out this form. They have to talk to somebody. You're asking for something, but you haven't given anything. You're asking on the promise of giving. They can't understand what any of this in the future means, right? Especially now. And so have something tangible that helps to build trust for the next step, especially if you're in an organization or a system where you know this is a long process. And most of us are because the money is slow. And so, because of that, there are a lot of steps. It is in our best interest to keep them engaged at every step. We're going to have to give something. So, hopefully, that's something that you're able to give is specific to the need. But if it's not, there's something that you can give that shows that you're willing to invest in the connection. You're asking, you're giving before you ask. Peer support and family navigation, especially in the child welfare system. The people with lived experiences are the people who need to be shaping what happens next, right? We give off unintentionally, maybe intentionally, by the intake forms and the several interviews that has to happen and the qualifications here that we don't believe you. That is the message of our entire system. We don't believe you. That is for reasons that won't change or go away, right? That's documentation. That's what we call it. That's why we don't feel a way about it. Oh, it's just documentation. It's proof to me that you're worth my time and effort and money, right? And so we can't get rid of that, but what we can do is have people who have been in the system say, yes, I know, and let's keep going. I know because I felt the same way, but let's keep going. And having people with lived experience makes a world of difference. And when you hire those people with peer and lived experience, you train them to the same caliber as the people who don't, right? And also, all of our organizations already have people with lived experience. We just haven't asked, right? Respite and crisis alternatives is a really, really low cost intervention that we don't make more use of. Sometimes people just need a break. Families need a break, right? Life is a lot. And if a parent can get a break for a month or two and be able to focus on some classes or just be able to focus on, let me work for 2 months, get some money saved, then I can get the house that I need or the apartment that I need, or I can buy my kid a bed, whatever the case may be. But respite is a short-term scenario, right? This allows you to not make a full commitment of giving your kid over to child welfare, right? And it's not long term. We're not going to do this for 6, 7, 8 months. We're only doing it for 2, and we'll reassess if we need to. What other ways that are not long term can we help interrupt how long this crisis is? Because we can have the crisis and let it go full, which a lot of the systems require the person to have already had the experience, had the crisis, and sometimes they want the crisis to be massive before they can respond, right? But that costs more money. And if we can't resolve it completely, well, maybe we can make it shorter. All right, so how do we do that? And then mentorship and healing spaces. This is where you bring in the holistic side, the whole person, the community, culturally rooted, making space for joy, identity affirming relationships. When people feel seen and they see other people who see them and they're connected to them, right? That matters. That's very stabilizing. So I have my little blurb up here because I always freestyle stories about the tangible assistance and things that we do. So when we have our kids, again, they are all across the spectrum, coming from all kind of things, right? They all have different things. But we have one particular kid, um, he got a job. We had a volunteer event or something like that, and somebody came and was doing something, got to talking to him and say, oh, hey, you know what? I am looking for somebody to come, and I think it was a car repair shop or something like that. And for a while, he would pick the kid up and take him. This is my 18 and up kid for anybody's going, he's an adult technically. And so, we'll pick him up. But that arrangement changed because his situation changed. And so he came to us and he said, um, I need a car, right? And so when my staff asked me, my first question is always, okay, maybe. But two, you need to also tell me, one, if you would do this for every other kid, and if so, how? Once you tell me that, then I'll make it work. I'll figure out how to do it. Well, they could not tell me that, right? Okay. So one, that means we can't do it, but what else can we do? What is flexible within our resources that would help him resolve this issue? Right. And so one of what we could do is we have Lyft rides and Uber rides. And so we cover them for the first 90 days so that they learn how to do it. Once that's over, you're expected to have figured it out. Well, he was well past that, but he had an arrangement. So we just revisited that. Okay, let's give it again for another 90 days and give you some time to save up some money. Through then, we started making other connections with people, and we were able, long story short, the kid got the car, right? And we didn't have to pay for it, which is a win across all of the things. But it starts by one being willing to not just think about a question in theory, a request in theory. No, let's figure out how to make this real for you, right? Small things. If you can do small things, that's much better than waiting up for this big grand vision, right? And again, trust is your delivery system. You do this because it establishes trust, and trust is how you build that connection and leading to prevention. It's invisible, but it's also priceless because this kid has not come back to us. This kid, as far as I understand, is still doing really well. Actually ended up moving because he was able to get on into that company as a permanent employee. So our work, us on a coalition, that's trauma work too. Right. And this came about for me talking with other colleagues about what happens when we go into some of these networking meetings. And yes, we were kind of, complaining about people and things that happen. And while we don't want to go to another coalition meeting because all the things. And as we are, we also say, okay, but how would we address it? Like, we got to change it because we need to talk. And collaboration does work. I mean, I have my master's degree is in multidisciplinary human services. I ain't never seen it done. We try, we really do try. And we need to keep trying. And again, as I find, there are still some patterns that we bring in that are coming from all of our experiences, right? And so I'm just going over a few of what you may see. And the reason why is once we acknowledge what's happening, we can change that, right? And so the hoarder is a person that you might meet at some of these coalition things. This is the person that guards all the information, they guard all the data, they won't really say what happened, right? And what happened is they were in an environment where transparency was weaponized. And so they learned from that to keep it quiet, to keep it small. Well, you're robbing other people from helping you or using that information in a way that you might not have been able to use it, right? The performer. This is the organization or this is the person who only presents the highlight reel, right? They only want to show the good things and make every number look really good, right? And so where's that experience? This is coming from being in a climate where success was only dictated by how good you looked, right? And if you didn't look good, you will not survive. So you had to only present the best foot forward. Right now, Youth Oasis has a fundraiser out right now because our budget is down, right? We got hit hard. Child welfare got hit really hard this year, right? And so, does that feel good to say? No, but we need to say it because at the other end of that is kids are not getting served. We're getting referrals and we're having to say no because we're having to close programs, right? And so, well, if we want to do this, we're going to have to say something. And so, being in an environment, looking at the coalition that you said, if you are convening a coalition, am I making it so people don't feel like they need to perform to be here? Right. And then you have the translator. That's the role I used to play a lot. This is the person that reframes everyone's words, right? And this is because I took on that role because, somebody inevitably takes offense to something somebody else says. And like, hold on, wait. Here's what I hear, right? And it's being that bridge. And if you're able to keep the bridge together, you're able to keep the environment together, right? And that's a translator over a while, after a while that gets tiring, right? And so these are just a few of the roles and things that can show up. And so understanding when you see that is not to call them out and say, hey, stop translating. It's to understand what they're responding from and then see if there's room for changing, right? And so we want to pay attention to that because we're talking about this for the purposes of assisting youth, but we are also getting stuck. Right? So if we can't hold ourselves, how can we hold them? Very good example from that. Just work with organization. I work with other organizations at my consulting firm, and I was doing a round of interviews with their peer advocates. And these babies told me, we cannot be the adults that they want us to be if they can't act like adults. And this is why I say let the kids talk, because the adults that I'm there to work with, at no point did they feel like they were giving a bad example. But kids pay attention. Kids do not always learn by what we say, they learn by watching what we do. Right. So this trauma-informed practice that we spend this time meeting about applies to how we treat each other as well, not just how we're treating our youth and our kids, right? And so we want to move from siloed services to shared stewardship, right? Siloed services, what does that look at? Look, refer and release, right? We don't do that. We do warm handoffs, right? We always connect. So that helps bridge the gaps with the agencies and helps the kid feel more comfortable with the referral that we're giving, right? Data being guarded by agency, shared data conversations, which lead to shared learning. That's stewardship. Hey, our numbers were down last year. How were y'all's? Oh, it was up. What's the difference? Right? Okay, what did y'all do, Matt? Maybe we can do that too. Oh, we can't do that. So how about we have a different referral pipeline, right? Success is my program's numbers, right? How did they do in this agency? Well, what we also know is data has shown us that it takes on average 7 to 9 agencies to actually help a kid going through it. Success is not just your program. You are counting on, whether you know it or not, you're counting on all these other 7 to 9 agencies to also be successful, right? We can't count success unless we're looking at the entire experience of the young person, right? Looking at youth as clients of systems instead of looking at youth as neighbors. They're our kids, right? We don't use client, we use participant, right? Some agencies use youth, some agencies use kid. And most of us talk like, what do you want us to call us? Our kids, like, I don't care. But there are some agencies and some kids where they really care, like, don't call us kids, right? Call us something else. Ask your participants what they like to be called, but see them as the people that they are, right? And so when we're able to integrate trauma-informed care at a coalition scale, right? This leads us to be having to have shared language, shared data, and shared accountability. This is how we move coalition work to actual real life, real world consequences, right? So, what you can do from where you are, and these are really simple. Of course, we can talk about much more individual conversations and all that, but it's always one small shift. Never leap to the big end. Start where you are, one small thing, right? Small acts of refusal and repair counts. And I say that because I was a case manager who would absolutely go, I'm not doing that. I'd figure out how to comply with my documentation, but knowing that that did not work for my client, I'm not doing that, right? My job, I am employed by these people, but my job is to this person, right? So if you're in a clinical and a behavioral health field, right, screening for unmet material needs in addition to symptoms, right? Treating your housing and food as clinical issues that they are. And we already know this. Again, that statistic, I believe, is 70% of what helps a person recover from a medical illness happens outside of the hospital, right? And we extrapolate that to other industries. But housing, food, basic needs does have an impact on your therapy session, right? So how do we screen for that? Schools and education, replace one punitive response with a connective one, right? Make one trusted adult give a check-in routine. Another story actually did that for my kid. My littlest, both my kids have ADHD, but my youngest did. And he is young, so talk therapy is not always really a thing for them. What we did was we came up with okay, his behavior peaks here and here at this time, right? And now there were some steps before we had to get that, but yeah. Okay, behavior is peaking here, behavior is peaking here. How about we have a check-in here and we have a check-in here, 5 to 10 minutes. That worked, right? All he needed was that reset at those strategic points of the day that helped maintain what was going on in his body so that everybody had a pleasant experience. But it takes some thinking through. And we used to say in one of my former places of employment, sometimes you got to close the book and look at the person, right? And figure out what it is they need and find a place where you can do that. Child welfare and juvenile justice. Before removal or detention, exhaust one community alternative, right? And document what happens. Try something different. Before we go straight to the most extreme, what can we do to keep the kid where they are? Because wherever they are, stabilization does matter. Right? So, what's a community version of what it is we're trying to do with this high cost, high secure intervention? Housing and human services, lower one barrier, just remove one thing. One thing I do going into any agency, even my own, I was like, how much of this intake packet is mandated by the funder? Everything that's not, take it out, right? Like, figure out how to reduce barriers for people to actually engage in your system as opposed to just complaining that they're not engaging, right? And then if you're in a faith in the community group, offer belonging without condition, right? Become a respite, be mentorship, be a healing space partners. Churches and our faith community groups are places of respite. They are places of welcoming. Be that. A place where kids can just go. Kids always need a recreational space that allows them to just be without requirements, right? They are after school programs, but you have to go and do homework. And no, nothing is wrong with that. But after being in school all day and then you do your homework, sometimes you just want to not do, you want to breathe, you want to think. And for some reason, we think that that's reserved to adults, as if kids aren't going through that, right? All right. So I always talk about funding because I'm usually talking with nonprofit organizations about, okay, so you said all that. I can't pay for any of it. Well, you can sometimes. You just got to figure out how to make it work, right? And so we do braided funding, right? It is not easy, but we try not to have any single string for anything we do, right? And so these are just a couple of the funding streams that we've tapped into for our services. Federal Youth Service Bureau, but we're not getting that this year. So that, there's always these things that happen. They're out there. It's good to know about it. The COC competition, we're part of the COC. That competition has just been halted again this year. That's the federal government. These things happen outside of our control. But these are some streams that have more flexibility than we think, allowing for some of the work that we need to do, right? That's it. That's my time. I think I gave enough time for questions. And so that's my contact if you want to talk more about it. But that's what we do. Trauma informed practice, that's the bottom. We need to get to healing centered.
Well, thank you so much, Takoa.
Mhm.
I know I've heard, a lot of your expertise over the last couple years of working together, but always love hearing more from you and where your organization has had success, and love the approach to just do some of the small things you can. Because I think this is such a big challenge that I think it's easy for us to get wrapped up in that and just saying, what is one policy we can change? What is one action we can take? So I love that perspective. We do have a question for you. Um, can you talk a little bit more towards the beginning of your presentation? You mentioned this kind of differentiation between surveillance and supervision. Are you able to talk about that a little more and maybe what that would look like in a juvenile justice context, or some of those kind of more extreme contexts?
Yes. So what I mean, again, surveillance versus supervision. Surveillance is typically coming with, again, requirements. So you're monitoring, you're one saying, I have to have cameras on you at all times. That's very intrusive, especially if you use cameras. So if you're in a place where you have to have cameras, and we are one of those places, there are also places where cameras are prohibited, right? To at least allow for the fact that you as a person are afforded some level of safety, right? And so whenever you have a situation where you notice there's more surveilled time than unsurveilled time, meaning they have to be under camera more than they can't be, then you're leaning into surveillance and not just supervision, right? Because where are they given the opportunity to demonstrate what you've been teaching them to do? Signing in and signing out is a part of supervision if there are consequences attached to not signing in and signing out. How severe are those consequences, right? Are there consequences when they go to work? Are they not allowed a buffer for traveling back from that place? Again, your surveillance as a shorthand means that you have a level of expectation for them and their behavior that you can't control, but you're attempting to control when they're not in your presence, right? Now, in a secure care environment, that's legally defined, right? I can't tell you how to operate, how to change that really well. Let me poke around the laws, I probably could. But as it stands right now, all of the things there are required. And so that is a surveilled environment, though. There's not a non-surveilled environment, so you can't expect that. But the population that we work with OJJ, they're still technically in detention. When they come to us, we're considered non-secure care. So part of that, when we first started the program, they essentially wanted to give us all the same rules that the kids had to have when they were in detention, and that's what we said no, because the point of this program is reintegration. And so if we bring all those same level of rules over here, they're actually not experiencing community integration. Kids get lost. Kids come home late. All of these things should be normal and it doesn't require a jail sentence, right? We have to work up to that, but we had to push back and go, if you want them to be in detention, keep them there. But you're bringing them here so that they have some community integration. We can't have all of this supervision and monitoring this way. It's not going to work for you or them, right? So I hope that answers your question a little bit.
Yeah. Thanks, Koa.
Mhm.
Um, an additional question. I know someone dropped this in the chat, and then I think you covered it a little bit, kind of right after that point, but maybe just to give a little bit more context, we had someone ask how closely you work with the parents as well in your work at Youth Oasis. Um, that it can be a challenge when parents haven't learned these principles, and that can kind of be a barrier to the child's healing and their experience. So I guess if you could talk a little bit more about that integration, what you're able to do there.
Yes, actually. And so one of the things that we did is we became affiliated with Building Bridges Initiative. And Building Bridging Initiative was really big on family voice and choice. One of those things being family integration. And so I learned how to integrate that into the organization, of course, because I'm extra, became a consultant and all of that. However, from there, we had family partner and peer navigators. That's where that comes from. And so we also started offering the same case management to parents. And so we would go into the home and we would meet with the parents too, because yes, that happens. They get into these systems and the kids get counseling, they get case management. The parents don't get anything, right? Unless you give it to them. And of course, funding matters for that. So, we don't have the funding to do it. We can't, but all of our programs are designed exactly for that. So to make, if you're a resident, we're going to meet with your parents as much as possible and bridging that gap a lot. So we talk to parents a lot, actually. We make that a core part of our services.
Do you feel, or I guess how difficult is it, do you feel, or how challenging is it for parents to adopt the principles that you're teaching them and sharing with them?
I would say it's probably about the same difficulty as you would have in any scenario. I want to lean towards this a little bit easier, but that's the eternal optimist in me. It's my staff would probably be like, no. What I find though is that at this point, again, by the time they get to us, everybody's tired, right? Like they are searching for answers. And so at this point, they are kind of willing to try anything. And so if that, like, yeah, just talk. Just don't yell, right? Like certain, they are willing to try it, so they're willing to listen a little more. There are some parents that we can't reach, and that's their own trauma, right? And so we keep that in mind, right? That we are all dealing with people with experiences that we don't have a lot of information about, and ultimately the kid is our client, not necessarily the parent. And so I don't know that it's any more difficult, but you do have to have the same level of patience and approach that you would with the kids because it is the same thing. And that actually tends to be what happened. They start kind of talking to like, oh yeah, this happened to me. Like, hold on, let me me get you to a counselor because that ain't what I'm here for.
Yeah, yeah, definitely. This wasn't necessarily a question, but someone named in the chat that they just find transportation to be such a big issue, which I know all of us, I mean, this is just like the constant struggle of transportation, and I know it varies also in different parts of the state. But I'm curious if you've found any solutions or kind of what your experience has been regarding transportation.
Transportation is a big, big issue. That is also a reason we started doing home visiting because I gotta pay for it anyway. I'd rather pay for mine than try to get you here to me.
Yeah.
We'll just come to you, and so that's one way. But some other communities have put together some things, like I've seen some communities where the city or the local government will collectively get a couple transportation vans and have agreements with organizations to use them, right? And they all share them, and they all kind of pay into it. I've seen churches do the same thing, like a network of churches, and if they'll take the kids somewhere, being a bit more strategic about it. As Louisiana is a largely rural state, one thing I always advocate for is decentralizing where we are, right? We have a lot of community centers and we have a lot of parks and we leave them for recreation only, but we could have social service days, we could have trauma day, trauma informed relief days or whatever you want to call it at a place where people already are. And
Mhm.
that's the big thing. Go where everybody is. So if you have a school that's in your neighborhood that's not being used, talk to somebody about what you can put in that school because we're still paying for that building in some way.
Yeah,
Yeah.
absolutely. And then we have one, maybe time for one last question before we wrap up. How did you address elopement of teenagers with families?
That is the hardest question for the few minutes that we have. Um, how do I address it? I need a little more clarity around that. Like what do we do or just
Tamara, are you looking for specifics around Youth Oasis's approach, or if you want to drop a little bit um, more detail in the chat around your question? And we'll just give it a moment.
yeah. What I can say while they're typing is when that that happens a lot too, and usually what we do is we do try to have a conversation because the law requires, right, that if a kid, especially a kid under 18, we've got to call that in, right, whether we
Hmm.
know it's safe or not. And the first we'll do that, but the first call is typically like, can you call your parents, right? And we just try to have a conversation with them, like what's happening, what's going on, can we find a place of, calm here? Which is again why respite really works. Help parents keep their children from leaving home. Can I help parents keep their children from leaving home? It depends on why, right? And so, yes, maybe sometimes it's we need respite, right? What happens? What does that mean? That means we need to find another provider or a provider with the funding who has a program who say, yes, you can come have your kid can come stay with me for a little bit while we work on some things, right? And we had that program. We hope to have it again. But that's not something that's funded in the state, right? The federal government funds that. And we only had one house with 3 beds. So it was not full all the time. Sometimes when parents are just letting them go, it's because they are at their wits' end, right? So sometimes we can convince them to stay, other times we can't. And so when that happens, what we do is tell them, here's what's going to happen, right? So,
To prepare them, set those expectations.
yeah.
Well, we are just about at time, and that actually was our last question. So thank you for responding to everyone, answering some of those questions. If folks do have additional questions for Takoa, she did share her contact information. We will also be sending up a follow-up email. We'll share the slides with y'all. There will be a recording, and you can always reach out to Takoa if you have more questions. Jordan has also just dropped in the chat the link to the SurveyMonkey survey. So for those who are looking for that nursing or social work credit, please make sure you fill out that survey so that we can count your attendance and get you those credits issued. She's also dropped in the link to register for any of our upcoming Lunch and Learns. Our next Lunch and Learn is going to be on Thursday, September 10th, all focused on how to create safer communities by understanding trauma in our built environment. So we would love to see you all there at the rest of our series. If you have more questions for us, please reach out. But otherwise, thank you so much to Koa for your presentation, for being involved in Whole Health Louisiana, and thank you everyone for attending today. And try to fill out that survey by end of day tomorrow, please, so we can get you your certificates as soon as possible. Thanks, everyone.
You're welcome. Bye.
Bye.